Hi, my name is Olivia Stevenson. I'm a pre-nursing major at UNLV. My public health issue is on teen pregnancy, and that may be a little bit more different than your guys's because when you talk about public health issues, it's very common to think about diseases and pandemics and that sort of thing. And teen pregnancy falls under a public health issue because it affects teen mothers disproportionately for their health and the baby's health, and it also affects teen mothers socioeconomically. Now, by this point in the class, we know that socioeconomic status greatly affects your health. So we're going to get into that a little bit. To start, the issue starts kind of with sex education. This can be seen as a primary prevention strategy. And what I mean by this is that in America, our teen pregnancy rates are much higher than other first world countries, and it's because of the way we go about education. Now, sex education is not federal, it is by state, and every state has a different belief about how kids should be educated. So typically along the Bible Belt of the United States, where it's a little bit more religious, you will see parents opting their child out, where in other states that's not an option. And there's also more abstinence-only approaches to sex education, typically along the Bible Belt and in states like Utah. And what happens when you have abstinence-only sex education is that the rate of teen pregnancy is much higher, and you have all of these teenagers who are engaging in sexual activity, and the difference between a teenager who has good sex ed and bad sex ed is that the one with bad sex ed is having the same amount of sex but in an unsafe way, which is what leads to teen pregnancy. A big issue is that only 18 states require you to talk about birth control in sex education, so a lot of kids don't really know about it or how to access it, and they're usually not having these conversations with their parents. And only 15 states out of 50 require medically accurate sex education. Medically accurate entails that it's peer-reviewed, statistically proven, scientifically researched education. So most states don't require that, and you'll see on my little chart to the right what states do require it and which states do not. I thought it would be interesting for you guys to see. When you do have good sex education, the rate of teen pregnancy drops 19%, which also decreases the number of abortions because there's less teen pregnancies, less abortions. You're kind of killing two birds with one stone. And to continue, we're going to get into socioeconomic issues, which I brought up earlier. You've already learned that minority Americans make up the majority of people who fall under the poverty line. The minority Americans also make up the majority of people with high teen pregnancy rates, and it correlates to why they are below the poverty line. This is typically seen in Black, Hispanic, and Native American minority groups, but not Asian. Asian minorities are not grouped in with this. They are actually a bit lower than white teenagers as far as teenage pregnancy percentages go. The highest percentages actually go to Native Americans, who have a 29.2% chance of becoming a teen parent, which is almost twice as likely as white teenagers, who are about 11.4%, according to the Center of Disease Control. When you are pregnant, typically your high school age, if you're a teen parent, 14 to 19 is typically where we look at here, 40% of those kids graduate high school. And those that do graduate high school, only less than 2% of them graduate college by 30 years old. Now, if you've had a child by the time you're a teenager, by the time you're 30, your child's between the ages of 10 and 15. They're a teenager themselves. And this affects children generationally. So if you were born to a teen mother, you are more likely to be a teen mother. This is statistically proven. A lot of it has to do with upbringing. If you cannot have a good job and you grow up in a bad part of town because you don't have a high school degree, which is all correlated, then you are more likely to grow up in an area that has poor education, to be more exposed to things like drugs and alcohol, because we learn that drug and alcohol companies do target poverty-stricken neighborhoods. And so a child is more likely to be around this sort of environment, which typically promotes an unsafe, unprotected sex. Teen pregnancy is very high here. So we know that socioeconomic status affects your health because stress is deadly, and stress is very prominent in people who live below the poverty line. And to continue, health risks. So we're going to talk about health risks. Teen parents are more likely to give birth to a baby with low birth rate. A lot of this has to do with that teen mothers are not done growing themselves, so then when you have to stunt your own growth to develop a new life, it puts a toll on the baby, and the baby typically does not develop on the way that it should. This leads to also poor cognitive development and more admissions to the hospital for the baby early on in life. It also has a higher rate of infant mortality. Teenagers who have babies fall under the category of highest infant mortality out of any age of people who have babies. Yeah. And for the mother, one important thing that I put on here, you can see some other illnesses on the left screen, but one I would like to talk about is chronic endometriosis. That is a chronic issue. It's very hard to get treatment for. It's when the inside tissue of your uterus is growing on the outside. It's very, very, very painful, much more common in teen women who have had babies than other women, other mothers. So we tapped on prevention strategies a little bit already. We know that accurate sex ed drops the rate of teen pregnancy. We know that access to birth control drops the rate of teen pregnancy. For secondary prevention, this is a little bit more difficult than like any other diseases because pregnancy is black and white. You are either pregnant or you are not pregnant. I put the morning after pill in the secondary prevention method because it's for people that suspect they are pregnant but who are not. So I guess technically you put it in primary prevention, but we'll get into it. So the way that you would get a morning after pill is it's over the counter. A lot of times it's called Plan B. It stops the fertilization of a zygote. So what that means is the release of an egg through a fallopian tube is halted. Therefore, it does not come out. Or if the egg has already released, then the body will contract and shed the uterine lining, much like it would during a menstrual cycle. When that happens, the egg cannot implant into the uterus, therefore no conception takes place. So it is not technically an abortion. It's not, it should not be used as regular birth control. It's more of an emergency only situation. It can be taken up to 72 hours after unprotected sex, but you're suspicious that you're pregnant at this point. And tertiary prevention is for people who know they are pregnant and want to do things about it. And so the biggest thing you can do is tell them their options, which are adoption, parenting, or abortion. You have to be very straightforward with young moms about this because it is a limited time frame to where they can make that decision. In Nevada, I believe it's up to 20 weeks. So if your client wanted to get an abortion, they have up until that point to decide. Or an adoption, that's also a very long process. So it does need to be made kind of early. Another thing is mental health care. A lot of young women who fall pregnant are ashamed because it's typically not a planned pregnancy. When this happens, there are a lot of places that help. One is called All Options, which is a hotline that you can call 24 hours a day, 7 days a week. It's basically to get parental advice or to talk to somebody if you're not comfortable talking to your family. A lot of times people are not. And there's certain government organizations as well, such as WIC, which is Women, Infant, Children. WIC helps you with finances, food, preschool, stuff like that up until the age the child is 5, I believe. All right. Here are my reference pages. I hope you learned a few things, and have a great day. Thank you.